How to treat benign prostatic hyperplasia, or BPH. Stay tuned. What's up, guys? Hope everyone's been doing well. For those of you who don't know, my name is Edgman and I'm a pharmacist, and I enjoy making these videos about common questions patients have about medications or any healthcare related topic. So be sure to subscribe for more content. Now to the rest of the video. Benign prostatic hyperplasia, or BPH, is considered the enlargement of the prostate which causes difficulty in urinating. Now, the enlargement is not considered to be cancerous, which is why they call it benign. And this condition only affects males because females do not have a prostate. There are a few common symptoms of BPH. One is because of the enlargement of the prostate causing pressure or constriction on the urethra, causes difficulty urinating. So when you go to the bathroom, you might have the urge to go, but it's very hard to pass that urine. That's one of the causes, is the enlargement of the prostate. Also, the enlargement of the prostate can also cause pressure towards your bladder, which causes your bladder to constrict, which might give you symptoms of an overactive bladder, meaning that you're constantly having the urge to go to the bathroom, but even though you don't have anything to void. So those are the two types of symptoms that are commonly associated with BPH. Now in this video, we're not going to be talking too much about the diagnosis of benign prostatic hyperplasia, but instead we're going to be talking about the most common treatments and or medications. There are a lot of different medications used to treat BPH, but in this video, we're going to be talking about the two most common ones seen in practice. The first medication we're going to be talking about is also the most common medication used to treat BPH, and it's called Tamsulosin, also known as Flomax, and it only comes in one dose of 0.4 milligrams. And the way this medication works is that it basically relaxes the muscles in the urethra and bladder, which helps urine pass through more easily. So let's take a look at this medication. And a funny story is that this medication was the first medication I memorized as a pharmacist, because when you're a pharmacist, you have to verify it's the correct actual capsule or tablet in the vial. And I recognized the D53 was the first one I memorized. I memorized a lot of different ones, but this was the first one. So let's take a look at the capsules. You guys could see the D on the green and the 53 on the orange. And something to consider when taking Tamsulosin is that it does take about 1 to 6 weeks to see some effects from this medication in regards to having more ease passing urine, which you guys might think that's a lot, but compared to the next medication we'll be talking about, this is going to seem like it's a fast-acting medication. Now, this medication does have some side effects, and one of the most important ones to consider is called orthostatic hypotension. What that basically means is that you want to be careful when you're going from a prone lying down position to standing up, because a sudden change from a lying down position to standing up might cause your blood pressure to drop suddenly, which might make you more faint or might make you more dizzy and makes you easier to fall. And so we always counsel or make sure the patients understand the risk of taking this medication. So let's say you are on Flomax or Tamsulosin and you go to bed at night and you wake up in the morning, what I would recommend to my patients is to slowly wiggle your fingers, wiggle your feet, maybe sit upright before actually standing up to make sure you're well adjusted in terms of your blood pressure, and then stand up. Because if you stand up too fast, then your blood pressure might drop too quickly, and a sudden drop in blood pressure will make you faint, and then you have the risk of falling, maybe hitting your head against something. And so we want to prevent those injuries. The next medication we'll be talking about is called Finasteride, also known as Proscar. And the way this medication works is that it basically helps shrink that prostate, which directly alleviates pressure on the urethra, directly alleviates pressure on the bladder, which helps urine flow much more easier. And now with this medication, it does take a lot more time to start seeing some results compared to Tamsulosin. We talk about Tamsulosin taking about 1 to 6 weeks to see results. With Finasteride or Proscar, it does take up to 6 months to see results. So with this medication, you have to be patient in terms of seeing some results, but it is very effective. And the 1 milligram version of Finasteride is used to treat male pattern baldness or alopecia, and we'll talk about that in a next upcoming video. Now let's take a look at the tablets. And in the next part of this video, I'll talk about why it's so important to handle Finasteride with care, especially if you're a woman. So let's get that out of the way. An important aspect to consider when taking Finasteride is that it's pregnancy category X, meaning it has the highest form of risk towards a fetus or a baby. Now, you're probably wondering, wait, I thought BPH is a condition that only affects males, and if I'm taking finasteride, I'm a male, so I don't need to worry about being pregnant. But the risk comes in two different forms. One, if you're a female, let's say you're a pharmacist or you're a pharmacy technician and you're pregnant or you're trying to get pregnant, you shouldn't handle finasteride. So you shouldn't like hold the tablets in your hand. And if you are going to handle finasteride, you want to make sure you're wearing rubber gloves to protect yourself. And the second reason is that women who are pregnant or are trying to become pregnant shouldn't come in contact with semen from a man who's taking finasteride, because that also poses a big risk to the fetus. So this is a big counseling point for males who are taking finasteride, who might be trying to get pregnant, and it's a consideration for even for the female to know that this medication poses those risks. Now there are other side effects to these medications, as well as other medications used to treat BPH. But in this video, I only want to talk about the two most common medications that are used in practice, and also talk about the most hallmark side effects that to consider, because it's hard to explain to patients every single side effect to every single medication, because it's just like a laundry list of things. You want to basically make it concise and just focus on the most important stuff, which is what I try to do in these videos. So I hope you guys enjoyed watching this video and learned something new. If you did, please give me a big thumbs up. Make sure to comment any feedback or questions you guys have for me. Until then, I'll see you guys next time. Thanks for watching.